Hello and good evening, everyone. I am Dr. Aman Khera. I'm co-founder Care for Parents. Thank you all for joining in today. Today, we are discussing a very important topic on infectious diseases and their prevention. And today, our focus is going to be about infections in the elderly and how we can prevent it with focus on the vaccination and immunizations. We all know that infections is one of the most common reasons for which anybody or everybody goes to a doctor to see a doctor basically. Infection can occur at any age. It can occur in the young age groups, in the children, but it is known that infections are more common in the elderly people. And there is a very obvious reason because as we grow old, as people grow old, the immune status, the immunity or the defense mechanism that we have in the body towards infection, that decreases. And there are many reasons for that also. Not going into detail. Some of the reasons can be because we know that as people grow old, their diet intake goes down. People tend to eat less, so the nutrients go down. So as a result, the normal immunity cannot develop. Also, chronic diseases, people have diseases like diabetes, high blood pressure. These all affect the immunity. And very important is that many elderly people are taking some sort of medications. So medications also tend to, like steroids, many of them take steroids. They tend to decrease the immunity of the person. And as a result, what happens is that they become more prone to infections. Now, infections can occur anywhere. But most commonly, they are seen. They happen in the lungs, in the stomach, liver, urine, skin, eyes. So it is definitely very important to know and understand that what is your susceptibility towards infection. Are you at a high risk for developing an infection? And yes, if yes, then what is the way that we can prevent it? So along with the importance of knowing your susceptibility, it is very important to know that how the infection can be prevented. We all know and we all remember that when our children were small, we used to take them to a doctor for their vaccine and their shots. And what was that for? Basically, that was for preventing them from infections. So today, if vaccination is definitely very important for the children, but equally important for the elderly people also, because many commonly occurring diseases, which can be sometimes very dangerous and even fatal, can be prevented by a simple vaccination. So today, to discuss about this topic on the infections, diseases in the elderly, as well as the vaccinations, we have invited Dr. Ruby Bansal. Dr. Ruby Bansal is a senior physician and an infectious disease specialist. She has been associated with various hospitals in the past, like Mac Group of Hospitals, Yashoda Group of Hospitals, and is also associated with Care for Parents. So I would like to extend my gratitude to Dr. Ruby Bansal. Thank you for joining in today. My request to everyone is to listen to her carefully. She's a very experienced infectious disease doctor, and also post any queries if you have any doubts, if you have any queries, if you want to ask anything about vaccinations, when to do, how to do, how many shots to put. Please feel free to ask. We will be talking about some simple basic reasons. I mean basic common infections that happen that occur in elderly. So thank you, Dr. Ruby Bansal. Thank you for joining. Let's start with something about what are the common infections that happen in elderly and how do they present. Over to you, Dr. Ruby.
So, namaskar everyone. Thank you, Dr. Aman. Thank you, Care for Parents, for inviting me. And I am associated with so many of elderly people who are the client of Care for Parents, and they are doing much well. They are very happy with the services of the Care for Parents. So, yes, Dr. Khera, it is a very important topic, infections. And as we know, infections occurs as much as fast in children so as in adults, elderly population. Because जैसे कि कहा भी जाता है कि बच्चे एंड बूढ़े एक समान होते हैं, राइट? सो जैसे ही सेम आपने जो बात कही कि वैक्सीनेशन इज इफ फॉर द चिल्ड्रन, सो फॉर द एडल्ट्स, elderly population also. So what are the common infections which are nowadays around? I will just talk of the current infections. because it's you can see the rainy season in most part of the country. And if we talk about the Delhi, Mumbai, or Gujarat and UP, so there are type of the flood situations are also there. So what are the common infections which is around now? It is the malaria, it is the dengue, is already started. Flu, we are having the lot of cases of the typhoid, and now Delhi NCR is rampant with the conjunctivitis. So eye flu, which is called as eye flu. तो ये सारे infections, I will use a mixed language. I know basically because the people Hindi and English both are
That's
there.
fine. That's fine.
So these are the infections which are around and which are troubling. So conjunctivitis, again, it has come like an epidemic. So if you go to the Delhi NCR roads, I don't know what about the other part of the country, but Delhi NCR is definitely having a sort of the epidemic of the eye flu because of the this rains and post rains syndrome, and a lot of area are having the floods. So it is, but and अगर हम बात करते हैं कि elderly की, so elderly में भी same infections हैं, बट उनका थोड़ा सा एक तो प्रिवेलेंस ज्यादा होता है एल्डरली में, जैसे कि बच्चों में ज्यादा है तो ऐसे ही एल्डरली पॉपुलेशन में ज्यादा है। और जो थोड़ा सा डिफरेंटली बिहेव करते हैं, जैसे कि बच्चों में इन्फेक्शन थोड़ा सा इन्फेक्शन हो जाए तो इट कैन लीड टू द, अगर फ्लू हुआ है तो निमोनिया। सेम इज इन एल्डरली पॉपुलेशन में भी अगर माइल्ड इन्फेक्शन भी होता है सो इट कैन लीड टू द even can go into the lower lung and can be created the pneumonia or some other diseases. So these are the things which are around as of now.
So what are the common infections that we should discuss today? Like now when the seasons are changing, flu and pneumonia are going to come up. So can you tell something about flu and pneumonia and what about the prevention of that?
Yes, flu, which is called as the general, we know it is a viral infection. So either you say it a viral infection or this flu. Flu is of multiple type. We just used to talk about the flu का जो नाम पड़ा है, that is because of the swine flu. तो जब swine flu की epidemic आई थी तब से flu पड़ा था. Otherwise, every infection, every viral infection is a flu sort of the infection. उसका मतलब क्या होता है? खांसी, जुखाम. So cough and cold, which is a normal thing, and लोगों को लगता भी है कि बहुत जल्दी ठीक हो जाएगा. It is a normal, and basically because it is a viral disease, that's why it takes its own time, right? So approximately 1 week to happen, and it is a contaminated also. तो एक से दूसरे को होता है. If it is happening to the one family member, it can occur to the all family member due to the contacts, cough, sneezing, and the touching. But elderly population is more vulnerable. जैसे कि हमने जब कोविड की बात की थी तो कोविड में भी यही था कि बाहर जो लोग जाते हैं वो इन्फेक्शन लेकर आते हैं, एंड एल्डरली लोग जो घर पे ही रहते हैं बट उनको इन्फेक्शन हो जाता है. सो दैट इज हैपनिंग विद द फ्लू ऑल्सो. So if somebody in the family is sick, so elderly people are more prone to get this infection. Simple thing, cough and cold, just, and the fever can be high grade fever, and it does not go with the normal paracetamol and something, because it is getting the very high. It can go up to the 104 degree Celsius, and which is important to understand for the elderly population. If the fever is high, what to do, right? Because they already have the low immunity as a natural immunity goes down as and when we grow up. Plus, they have the comorbid conditions like diabetes, hypertension, coronary artery disease, or any other. Some few people have the kidney problem, few may have the cancer survivor, few may have with the different problems they have been associated. So in those conditions, these symptoms can take the serious problem, can take the serious health issues, and it can create the pneumonia. From flu, even it can go through the pneumonia. And pneumonia itself, another problem which can occur directly to the, which can happen to the elderly population who are vulnerable, especially the diabetic, kidney patients, and the heart patients whose immunity is down. So that's why precautions, if we talk about the precautions are definitely to avoid the crowded place, to avoid the gatherings, to avoid the touching here and there surfaces, to avoid the coming in contact with the sick people. So that is the very important prevention. And even COVID has taught us all the precaution of the hand washing, sanitizer, mask use of the mask, and avoid the contacts to these handles and these things. So we should continue. We should continue that good practices that will be very helpful to prevent even the seasonal flu, to prevent the swine flu, to prevent the other infections. So that is very important. So this is the prevention one way. Second prevention is Dr. Aman Khera has talked about the vaccination. So this is very important for the elderly to take the vaccine. This is the preventive vaccine. We have the flu vaccine. Flu vaccine is a quadrivalent now available. It is available the bivalent and it is available as a quadrivalent. So quadrivalent means जिसमें 4 वैलेंट के टाइटर होते हैं, जो सब टाइप ऑफ दी फ्लू 4 वैलेंट के होते हैं. फ्लू एवरी वैक्सीन जब हम वैक्सीन बनाते हैं तो उसमें जो पिछले साल के फ्लू के स्ट्रेन्स होते हैं उन सबको कलेक्ट करके and then they create the new flu vaccine. So that is why it is seasonal. Every year you have to take the shot, and in every season before the flu comes. Season of the flu is different in the southern pole or northern pole. Southern pole and northern pole was around the northern pole. पहले European countries को कहा जाता था, and southern pole is the Indian and Asian countries. But अगर हम इंडिया की भी बात करें तो we also have the same poles, northern pole and southern pole. So southern in the South India, where the season of the rains is monsoon comes in a different season, and in the northern India it is coming. So in northern India we are usually having the flu either the post rainy season or becoming as and when the winters are coming. So we have the 2 seasons of the flu. That's why the vaccination should be taken in the August, September, or in the March and April. So 2 type of the strains coming. Every time once you are taking, you should check whether you are taking a new vaccine. As and when the new vaccine comes, all the person should take that vaccine, flu shot, yearly shot. It is very safe. No complications. Hardly any people had any complication. Few people can have this mild fever. Rest of people does not get any kind of the symptoms, and it is has a good preventive method. And we have seen lot of studies have there which are saying कि flu vaccine से काफी हद तक लोगों को फ्लू का बचाव होता है. वैक्सीन, किसी भी वैक्सीन का मतलब नहीं है कि 100% गारंटी है. कोई भी वैक्सीन या कोई भी चीज 100% सपोर्ट नहीं देती है, परंतु या तो फ्लू होगा तो उसकी कॉम्प्लिकेशंस कम होंगी या वो होगा नहीं. So at least this is there. The same was with the COVID also, COVID vaccine also. So same, it is if COVID is another version of the flu. So which we have just given the name the strain the COVID, but it was having the different complication, and the flu, any flu can have the different kind of the complication, even the pneumonia. Second vaccine is the pneumonia vaccine. Pneumococcal disease से बचने के लिए we have the 2 type of the vaccine, PSV 15 and PSV 23 as of now in India. If we talk about the Europe and America, they have the PSV 20. 20, only the 1 shot has to be taken, and it is covering, because this vaccine they have made the 15 and 23 together. But in India, we have the separate PSV 15 and PSV 23. So we have to take the 2 vaccines. First, we have to take the PSV 15, and after 8 weeks, we can take the vaccine, this pneumococcal 23. So that 2 shots has to be given after the 50 years of the age. And this has a very good preventive mechanism, and a lot of hospitalizations are being reduced in the elderly population who were much prone to the pneumonias, who are much prone to the any kind of the upper respiratory or lower respiratory tract infection. So these vaccines are very good and very safe. So one should use. And these are the vaccines which 2 shots you have to take. And PSV 23 only the twice in the lifetime, and PSV 15 only the once. So that you can take the and few patients, a personal your doctor can decide. So sometimes we are giving differently, maybe in the higher dose, or who are the severely immunocompromised patient. So just talk to your doctor before taking the vaccine, and talk to the care for the parents if you need any kind of the vaccination support.
Dr. Ruby, I would like to ask you one thing.
Yeah.
That you have mentioned about 2 very common conditions which are very important, which is the flu and this pneumonia. So are there any contraindications for these vaccines? कोई मतलब ऐसा कोई है जिनको मना है, सख्त मना है कि उनको वैक्सीन नहीं देनी चाहिए?
So, as such, there is no very typical contraindications for these vaccines, except that someone has the individual allergies. Any vaccine can create the any allergy. So, few people, if you have the egg allergy, but not all the egg allergy cannot take the vaccine. It is not correct. Only thing if they have the past in sometimes the anaphylactic shock with some vaccines, they should avoid the vaccine. Otherwise, there is no such any contraindication for these vaccines. Only if we talk about even flu vaccine is safe in the pregnancy, and we are more promoting in the pregnancy because it is preventing the mother as well as the newborn child, because it is creating the immunity even the unborn child. So that's how these vaccines are quite safe.
So this is very important that what we have heard today, that for everyone, as a matter of fact, everyone should get this pneumococcal and their flu shots, flu vaccinations done, because this can, and rightly said, this has it has been found to it has been seen that the incidence and the severity of the disease has gone down by this vaccination. So the only problem is that we all lack awareness. So we should all know and understand that these vaccines are very, very important for everyone, especially the elderly people, because again, the immunity levels are low. So now, as what Dr. Rudy said about in the season now for because of the rainy season, dengue and malaria are it's bound to increase now, especially in Delhi, NCR, North India, is bound to increase. So, Dr. Ruby, can you please tell about that? Because we remember hospitals get full with dengue patients and malaria patients. So, can you please give some opinion on that?
Yes. As we know, the malaria and dengue is a most common infections in the rainy season, post rain and the rainy season. और कहीं भी पानी इकट्ठा होता है, सो जैसे कि मलेरिया का जो पैरासाइट है वो गंदे पानी में पैदा होता है और डेंगू का साफ पानी में. So this is the two contrast. So avoid both the water. If it is a dirty water, so we should avoid. And if you are collecting the, saaf pani, clear water,
Clean
we should
water.
avoid this. So important is where the water is collecting. So आप जो हम सब लोग करते हैं कि हम सब ने कोई बर्तन नहीं भर के रख रखा है, हम सब लोग खाली कर देते हैं. और very common in India, मतलब if we see the ancient culture, very rich culture, how they were just preventing the infections. You know, I remember in my childhood, जैसे ही बारिश होती थी तो कूलर जो है साफ करके बंद करके रख दिए जाते थे. So what was the reason? Reason was कि वहां पर मच्छर पैदा नहीं हो, because उसकी जो खस होती है या उसका जो पानी होता है, you are not changing every day. So वहां पर मच्छर नहीं पैदा हो, इसलिए बरसात के सीजन में कूलर का कोई काम नहीं है. So these are the things, these are the preventive. And especially जो आजकल हम देख रहे हैं, दिल्ली में तो फ्लड आई हुई है, तो you can't avoid that कि आप उस पानी को वो कहीं से निकलने के लिए तैयार ही नहीं है. And that is also somewhere we are contributing in that using the plastics. So we are using a lot of the plastics everywhere. If you will see, there is the plastics. All the drains and they are blocked with the plastics. So this is the another message which I would like anybody should not. We should not use the plastics, and we should transfer this also to our generations, new generation. So machhar agar, and especially what is important in the elderly, we are afraid of both the disease, malaria and dengue. Why? Because they are taking it, they are getting it very seriously in the elderly, especially heart patients. Why the dengue is very dangerous in the heart patient? Because heart patients जितने भी होते हैं, सब आपके जो है एक जो खून पतला करने वाली गोली होती है उस पर होते हैं, right? Aspirin or the clopidogrel. Few have the partial in the past heart attack, few are having the CABG. So they all are, most of them are taking this. And even as a prophylaxis for even the diabetic patient, we are advising these statins and plus the blood thinners. तो एंड डेंगू में क्या होता है, जनरली आपकी जो ब्लीडिंग की कैपेसिटी होती है वो बढ़ जाती है. सो ब्लीडिंग मतलब प्लेटलेट्स काउंट कम हो जाते हैं और वो ब्लीड करने लगता है, और आप ऑलरेडी खून पतला करने वाली दवाई पर हैं, तो इसीलिए वो बहुत डेंजरस सिचुएशन होती है कि आप उस दवाई को बंद करते हैं तो आपका हार्ट गड़बड़ हो जाता है, और अगर आपको डेंगू हो गया है तो आप अगर नहीं बंद करते हैं तो आपको ब्लीडिंग हो जाएगी. सो वेरी इंपॉर्टेंट, elderly should not ignore the any kind of the fever. We should check for the malaria, we should check for the dengue. If the dengue is there, definitely you should talk to a doctor. They will stop the clopidogrel and they will minimize the dose of the aspirin, or maybe the stopping the dose of the aspirin. And they should avoid कि कहीं से भी bleeding नहीं हो रहा हो. Constipation, जिनको piles है, they should look for, especially अगर डेंगू हुआ है तो वो कहीं ब्लीडिंग पीआर लैट्रिन के रास्ते से खून तो नहीं शुरू हो जाता है, बिकॉज दैट इज द मोस्ट डेंजरस कंडीशन. Otherwise, we don't have any treatment for the dengue. Only thing, the hydration is very important. And in elderly, self-hydration is fatal. So believe me, it is not something कि हमने सुन लिया है टीवी पर और उस पर कि नहीं भाई पानी पीना है. यंग को हम बोल देते हैं कि 4 लीटर पानी तुम भैया दिन में पी लो. But elderly population, we should be very careful for advising water, for advising any sort of the disease. If somebody is having the heart failure, we know if we will just give the more water, उसके lungs में पानी भर जाएगा. तो इसलिए always talk to your doctor. I am just a very clear message to the all the elderly. If they have the fever, please talk to your doctor, and you should take care of, and we should diagnose it timely, whether it is malaria or the dengue or any sort of the fever. So that is a very important thing.
So basically, what is very important that what Dr. Ruby has said is that any medical treatment, any treatment as such, should be under medical supervision, because the elderly people have various other diseases, issues, diabetes, heart disease, like what she's saying, and they are already on medication. So there can be a lot of interaction and there can be a lot of complications because of the pre-existing conditions. So please, everyone should remember that if you have any issues, please don't self-medicate. You should consult a specialist doctor. Now, Dr. Ruby, is there a way, are there any vaccines for malaria or dengue or any way to prevent, I mean, other than making sure there's no water?
I was expecting, Dr. Khera, this question from you. So basically, it's a sad part, yet we don't have any vaccine for the malaria and dengue in India. In the few countries, they have just a lot of trials has been happen, and the malaria vaccine has been given, and they found it successful, partial success. But in India, yet we are unable to, like, even world over, we are unable to make these vaccines. And the post-COVID, definitely the research has gone up. Post-COVID vaccination, because whatever has been done so far in such a quick way. So now every pharmaceutical and every nation is very much for the vaccines. So they are trying to create the vaccine, and maybe the sooner we will have the dengue vaccine also, which is a need of the hour, especially on the Asian part of this world. So India, South Africa, South Africa, there are a lot of people are dying because of the dengue and the malaria. So we should have something preventive vaccination, and we should cross the finger, and we hope in near future we will have both the vaccines available.
That is the need of the hour. If we yes. could all develop the COVID vaccine so fast, then I hope we are able to develop these vaccines also. Dr. Ruby, is it true that if somebody has dengue once, will not have it again, or
no? It's a myth, Dr. Khera, and rather it is an other way around. If someone has the dengue, suppose last year, if he gets it again this year, it will be more serious. So this is a true myth कि he cannot have this, but we should prevent. अगर एक बार हो गया है तो दूसरी बार से please बचिए, because hemolysis and the bleeding and the platelets count की कम होने की chances ज़्यादा होते हैं in the second thing. So we should be very careful.
This is very, very important. I had purposely said this because I wanted this point to come out, that yes, if you have had dengue in the past, in the last 1 or 2 years, then you have to be more careful now, so as to prevent a serious form of disease. So this is very, very important for everyone. Now, we were discussing in the beginning that you had mentioned about typhoid. Typhoid is also very common. So can you please give some knowledge about that how it happens, how can we prevent it, and about their vaccinations and role in it?
The typhoid, how it happens. Typhoid is due to the contaminated food and the contaminated water, right? So contaminated, what does it mean, the contaminated? Especially in the flood-like situation. If even we are having the drainage, water which is coming in the tap has been reconnected with the somewhere from the, drainage area or something, which happens very often. So you like it or not, unwanted, you may suffer with some kind of the infection, salmonella. So salmonella is a type of the thing, bacteria which is creating this typhoid. सो उसका कीटाणु अगर आपके खाने के साथ वो खाने के साथ या पानी के साथ आपकी गट में जाता है, अंदर जाके वो इन्फेक्शन को स्प्रेड करता है, पहले पेट में फिर पूरे शरीर में फैला देता है. So how you get this infection? Or good part, I must say कि in elderly that is not very common. The simple reason they are not eating out much. So in young population, hostlers, this is the very common disease which are getting in the youngs, but elderly not much. But if it can happen, as I am saying, if the contaminated water or the contaminated food you are getting, so you can also get this disease, and which is also you can have the fever with the chills and loss of appetite, and you can have the many complications after the post typhoid. So we should diagnose again. It is very important to diagnose it early, because this has a very good treatment option available, and we have the vaccine also available for the typhoid. But somehow we are not promoting much in the elderly so far, especially in the elderly. I am more promoting it to the hostlers who are going to the hostel, young children who are eating a lot of the momos and this kind of the stuff. So for them, it is very important vaccine. And elderly, if they are taking, so that is absolutely a additional advantage. So it also does not have any side effect, but it is also a good prevention of the typhoid vaccine.
So again, yes, although typhoid, as per Dr. Ruby, it does not happen much in the elderly people, because according to her, people don't go out to eat. Well, people can go out to eat.
It's I'm just thinking, I'm not getting much, but yeah.
but yes, you see, prevention is always better than cure. And yes, typhoid does have a lot of post-typhoid complications. Many times it can lead to surgical complications also.
Yeah.
So it is always better to be careful about what you are eating, boil your water, cook your food well, make sure that you have clean water coming, which is again a challenge in our country. So well, these are the basic things that we have to do. And of course, if you are keen, then a shot can be, you can apply a shot also. Dr. Ruby, most of these infections appear, I think the most common symptom is fever. So how do we at home, the elderly are there, how if they start developing fever, what should be the course of action, and how should they tackle that, and at what level should they come to a doctor, and how and what when the test should be done?
The elderly, even we are not, today's topic is not about the urinary tract infection, but the elderly is getting the fever because of the urinary tract infection also, very commonly. So in the elderly, if we are talking about the seasonal disease, that is the flu if the fever with cough and cold. So we should think about the flu, pneumonia, COVID, or such kind of the things. If the fever without cough and cold, fever is high grade with the chills. So two most important thing in the elderly comes in my mind, or I think in every doctor's mind, it is the typhoid and the UTI, urinary tract infection. If we don't think about the malignancy and other things. So it is the most common first click in the mind is about the this typhoid and the urinary tract infection. So we should think of these diseases, right? And patients who are having the diabetes and everything, this thing, so they should even think whether they have some injury or they are some type of the cellulitis. So कहीं पर पैर में सूजन आ रही है, हाथ में सूजन आ रही है. So we should club all the symptoms and then we make the diagnosis. And definitely history is very important. If you went out, कहाँ गए थे आप, क्या खाया था, शादी का खाना खाया था, या आप बाहर घूमने गए थे, पहाड़ों से आए हैं या समुद्र से आए हैं. So these are the things very important which gives us the clue about the fever, किस तरह का fever हो सकता है. Second thing is about the investigation. So very basic investigation for the fever is the CBC. The complete blood count, which we are saying hemogram or the CBC, it gives us a lot of information, right? Urine, simple urine routine microscopy again gives us a lot of information about the UTI, right? And we have the now fever panel available. So if we are just doing in this season, if the patient of the fever with coming to me with the vague type of the symptoms, and if it is not getting off in the 4 or 5 days, so we should take care of the, we should test for the malaria, we should take first 5 days fever, we should do the NS1 antigen. There are the different tests actually. Again, don't do the self-testing. you will waste the money and will not, outcome will not be proper, because every test has its significance about the days. पहले 4 दिन में क्या टेस्ट होगा, उसके बाद कौन सा टेस्ट कराएंगे तो हमें कुछ पता चलेगा, अदरवाइज वी विल मिस द इंफॉर्मेशन एंड वी विल मिस द डायग्नोसिस, एंड that is a very difficult if we are missing the diagnosis. Timely diagnosis is very important for the fever, right? If it is a urine infection, medicines are different. If it is a typhoid, medicines are different. If it is a dengue, medicines should be minimized. We don't give any medication. If it is a malaria, totally different medication. So we should be very careful about the just a fever.
So this is very, very important, because what Dr. Ruby has said, that again, and what I had mentioned, that if you have a problem, if you have fever, simple fever, if you are having for 1 or 2 days, then it's best is to consult a doctor, a specialist, because they will be able to understand what direction probably they have to investigate, what type of infection can be, and what treatment to be given. Yes, like what Dr. Ruby said, at some diseases you have to give particular antibiotics, some you have to give other, and in dengue you probably have to give least medicine, which is again very important. So this is the message that we are getting today is that, again, please do not self-medicate. Always consult a doctor or a specialist for if you have any problems. If you have any questions, please you can ask the questions also. Now, there is one topic which I would like to touch today, is about a disease which is very common in the elderly, but it is very less, it is not known, or people don't talk much about it, especially in India. Abroad, yes, it is people know about it, people have vaccines against it, but in India, the awareness is not there, and that is shingles. Many of you might not have even heard about that. Shingles is a very, very common infection that happens in elderly, and luckily now in India, now that vaccine is available. If you people who have been to US and all have, or probably could have got their shots also, it's very commonly available there. So, Dr. Ruby, please spend some time and tell everyone, the audience, what is shingles, how it happens, what are the symptoms, which is very important, because this, unless you do not know the symptoms, you will never have a thought about it, and of course, prevention and vaccination.
Yes, Dr. Khera, thank you very much. You have just raised this question basically, and you have rightly said, because the very few people know about this disease and its prevention, and which is we have the very good prevention now available for this shingles. If I talk about the Europe and America, so every elderly, they used to get this vaccine. Shingles मतलब herpes अगर आपने सुना हो, herpes का नाम herpes zoster, herpes simplex. So this is the herpes virus. Herpes virus जो बचपन में हम सुनते थे चिकन पॉक्स. So chicken pox का higher version is a something herpes virus or the shingles. So बचपन में चिकन पॉक्स का वैक्सीन लगता है, परंतु अगेन as and when we are growing, the immunity is shedding. So उस वैक्सीन की एफिकेसी कम होती जाती है, and that's why this in elderly this comes in a different form. उसी वायरस का डिफरेंट वर्जन करके आता है, जिसको हम शिंगल्स कहते हैं, या हम जो है हर्पिस जॉस्टर कहते हैं. तो ये एक स्किन का डिजीज है. आपको कहीं भी, स्पेशली ट्रायंगल शेप में इसके दाने होते हैं, चाहे आपकी नेक की साइड में हो, चाहे आपके एब्डोमेन की साइड में हो, चाहे आपके थाई की साइड में हो, या आपके फुट के या आपके हैंड के साइड में हो. सो एक साइड में आपको कुछ पुस्ट्यूल्स दिखाई देंगे, रेड काइंड ऑफ द मार्क्स. दे विल स्टार्ट विद द माइल्ड इचिंग एंड विद द सीवियर पेन. सो इफ यू हैव सच काइंड ऑफ द सिम्टम्स, एक जगह पर गुच्छे की तरह से या आपके छितराए से दाने हो जाते हैं एक साइड में, मतलब नॉट द बायलेटरल. Very rarely it goes into the viral. I have seen the bilateral herpes also, but rarely in some HIV positive patients, because they are severely immunocompromised. But usually it is on the one side of your body. It can be anywhere. It can be on the back, it can be on the stomach, it can be on the hand, it can be on the thighs. So अगर किसी को भी इस तरह का this is a typical viral infection. Again, these are the very painful. कहते हैं कि शिंगल्स वायरस के जो ये खत्म हो जाता है, पर पेन काफी टाइम तक रहता है, बिकॉज इट अटैक्स ऑन द नर्व्स. सो न्यूरल पेन होता है ये, और ये वहां के एरिया के नर्व को जो है गड़बड़ कर देता है, तो इसलिए वो पेन रहता है. सो वी शुड नो कि ये वाली एंड एल्डरली में इट इज वेरी कॉमन, बिकॉज जैसे जैसे इम्यूनो कॉम्प्रोमाइज हम होते जाते हैं, सो ये वायरस अपनी पकड़ बना लेता है, एंड इट इज ऑल्सो स्प्रेडिंग कंटेमिनेटेड, एक से दूसरे को हो सकता है, अगर घर में एक को हुआ है, इफ यू आर शेयरिंग द टॉवल, शेयरिंग द थिंग्स, तो ये दूसरों को भी हो सकता है. वी हैव द गुड ट्रीटमेंट अवेलेबल फॉर दिस, बट टाइमली. अगेन, कोई भी वायरस डिजीज का ट्रीटमेंट, वायरस का अटैक बहुत टाइमली होना चाहिए, अर्ली एज गुड. शुरू में ही लोग पेशेंट्स अगर आ जाते हैं और हम उनको मेडिसिन देते हैं, 7 से 10 दिन तक मेडिसिन खानी होती है, एंड दे विल बी क्योर्ड फुली. अगर हम बात करते हैं प्रिवेंशन की, वी हैव अ वेरी गुड वैक्सीन टू प्रिवेंट दिस. सो देयर इज शिंग्रिक्स के नाम से वैक्सीन आता है, विच इज 2 वैक्सीन, 2 शॉट्स ऑफ टू बी गिवन विद इन द आई मीन, पहला शॉट अगर आज दिया है तो 2 महीने के बाद, 2 से 6 महीने के अंदर सेकंड शॉट कैन बी गिवन. सो वी हैव द विंडो ऑफ द 6 months. तो 6 मंथ में आप कभी भी ले लें, मिनिमम बट 4 वीक्स के बाद, नॉट बिफोर दैट. कभी कभी लोग आते हैं कि नहीं हमें तो यूएस जाना है और आप हमें 2 हफ्ते में ही वैक्सीन दे दो, विच इज नॉट करेक्ट, बेसिकली बिकॉज वी नीड टू डेवलप द इम्यूनिटी. यू कैन गिव द वैक्सीन बट इट विल नॉट प्रोटेक्ट प्योरली वेरी गुड. अगर आपने ऐसा किया है तो देन यू हैव टू विद इन 6 मंथ यू हैव टू टेक इट अगेन द वैक्सीन, राइट? अगर किसी को इस तरह का भी हुआ है. सो वैक्सीन प्रिवेंशन इज वेरी इंपॉर्टेंट. और अगर हम बात करें बाहर की, सो इट इज अ वेरी कॉस्टली वैक्सीन देयर. इन इंडिया दिस वैक्सीन इज नाउ अवेलेबल, विच इज ए रिसेंट लॉन्च. पहले भी आया था, पर पहले जो है लाइव वैक्सीन था, और कुछ समय बाद उस बंद हो गया था, बिकॉज पीपल फाइंड कि दे हैड सम प्रॉब्लम. और अभी जो वैक्सीन है विच इज वेरी सेफ, एंड 2 डोजेज हैं, अप्रोक्सीमेटली कॉस्ट इज अराउंड 10,900 समथिंग फॉर 1 वैक्सीन. And so 2 shots has to be given, but it is a life-saving thing, because shingles in elderly can take the very complicated shape, and it can complicate the other things. Sometimes it is a disseminated disease where it's a life-threatening. So take this, prevent yourself, take these vaccines, and these are the very safe vaccines again. Only in the pregnancy we are not giving these vaccines.
So this is very, very important because what happens is that we do not know, many of us do not even know about this disease. And again, like what Dr. Ruby said, that as we grow older, if we develop shingles, the chances of developing complications and seriousness is very, very high. Till now, there was no vaccine available, fortunately. But now, fortunately, yes, vaccine is available, and we at Care for Parents have a tie-up, and we are, providing vaccines at your doorstep, and even a shot of can be given at your doorstep if required anywhere in India. So please think about it. Shingles is important. It has to be vaccination should be done to prevent yourself, because, like what she said, it's a very, very painful condition, and it's not safe to get this infection. And Dr. Ruby, does this spread from one person to other within the house and by touch?
Yes, I told you this can occur to the other persons within the house.
So that is again very
especially
important.
the elderly. If the young person is having, so elderly can catch it very easily.
So that is again very important, because if somebody has developed such rashes, it is better to isolate the person in the
Yes.
house, like we used to do in COVID times. Then
COVID time.
you quarantine the person, so that till we are not sure of the diagnosis, or at least till we are not sure that the infective stage has passed. So this is again very important. So again, vaccines are available. So the idea of today's talk is that we have to understand that what diseases are the common infectious diseases, and what all vaccines are available, and how often or how frequently they should be like. Dr. Ruby, anything else you would like to tell us about, like any eye infection you were mentioning in the beginning about that?
Yeah. Okay.
Also, in elderly people, a lot of skin infections take place. Can you please say something about that?
In this season, rainy season, a lot of fungal infections are there, and eye, this is the conjunctivitis, eye flu, जिसको बोलते हैं. So this is there. Only thing we need to prevent it. Prevent means again, don't go to the crowded place. If somebody is having eye flu, prevent prevent that person from the elderly population who is at home. So, and they should use the contact. Don't touch or rub your eyes. Wash hand. These are the precautions are very simple. The washing the hand, washing the touching. Don't share the towels and hankies of the other family members. And keep the area clean, keep your hands clean, and don't rub and touch the eye, which we were taking care in the COVID time. So these all precautions has to be taken for the eye flu also. And if you have the eye flu, definitely just consult the doctor, and they can give you the medication, the eye drops, which will ease your trouble, because it's a red eyes, you can say, or the bloody eyes. Again, elderly problem is this blood thinner. So if there is some capillary leak or something can happen even in the eyes, so blood clot aane ki chances hote hain. That's why just consult your doctor. We have sometimes this is again a viral disease, but we are preventing it with sometimes with the steroid eye drops and the antibacterial eye drop to prevent the secondary infection. And for the fungal skin infection, definitely this is because of the moist area. So always keep your areas, armpits, leg pits, so to clean, because in the this season, rainy season, because humus or humidity is there, so you can feel this the moist area. And every fold, especially who are the obese patient, they have the more fungal infection. People who are wearing the tight clothes, they are having the more fungal infections. So that's why our culture has made very beautifully this कि कॉटन के कपड़े पहनो, इंडिया गर्मियों में सूती साड़ी पहनना है या लूज क्लोथ्स पहनने हैं. सो दैट इज वेरी इंपॉर्टेंट कि आपकी क्लोथ्स एयरी होनी चाहिए. And especially in the young population who are the jeans wearer, very common this fungal infection in the groin area, because it's a tight briefs, tight jeans, that is also creating a lot of problem because not airy. So always wear that, and you can prevent it with the medication. So check with your doctor, because there are the fungal infection, there are the bacterial infection, and lot of these steroid abuse is there, which is not correct. So every time you should choose the right medication for the right thing to avoid the complications.
Anybody would like to ask any questions?
Dr. Aman.
Yes.
Good evening. This is Kishore Dudani from Khan Market, if you recall.
Yes. Hello, sir. How are you?
You told me that Mr. Vijay Kumar was your good friend, and he was a senior diplomat in our. I think he's right now in Sydney. Two things. One thing, his wife, who's a doctor herself, she had this shingles problem.
Yes.
Whatever.
Last month. Yes.
Now she's on better way. She was admitted twice or thrice, but she's on a path to recovery.
Yes.
Second thing, I would see the optimistic side of COVID. In one sentence, COVID was a blessing in disguise because it brought the people together. Do you agree with me?
Absolutely. But yes, those who suffered also suffered a lot.
Yeah, that was the real part. But at least they came together. They tried to help each other. Good.
Yes.
Nice talking to you.
Nice.
All the best. When do we see you? Whenever you are this side.
Anytime.
Yeah. Okay. Thank you.
Thank you. Anyone else would like to ask any questions, please? So, today we have learned 2-3 very important things from Dr. Ruby. One is the importance of vaccination, because always we have taught our children also, and we have learned also that prevention is better than cure. So it is always better to, prevent a disease and if a vaccine shot is available, might as well get it. That's a very, very important thing. And obviously, yes, we all, I'm sorry to say, but people, in our experience, people, they tend to live in denial. कि हमें नहीं हो सकता, दूसरे को हो सकता है. This is very, very common thing, but you should get over it. Take a plunge and get yourself vaccinated. Like what Mr. Dudani was saying, yes, shingles is very, very common. And I know somebody who developed shingles and was actually hospitalized, and and she's a very elderly lady and is now on the path to recovery. So, and shingles vaccine is now available in India, and we have Care for Parents has contacts where we can get the vaccinations done at your house, at your doorstep also, so without any problem. Another thing what Dr. Ruby has said is very important is, please, if you have any problem, don't self-medicate yourself. This is very, very important. Again, when just a simple case of fever, everybody has fever. We all have had fever. हर 5-6 महीने में साल भर में 1-2 बारी फीवर हो जाता है. But yes, it is important to talk to a doctor, get yourself properly investigated, and get the right treatment depending upon your baseline status, your health status, what you are already having. Treatment can be different. So these are two very, very important things. And of course, various ways, techniques of preventing infection like malaria, dengue. We all know water should not be there. You have to if somebody is having eye flu, you should not touch their towels, share their towels, and these things. These are there. But these two are very important things. So, anybody else would like to ask anything? So, well, I think that was a great session today. Thank you, Dr. Ruby. It was a very nice interacting with you. And if anyone needs any help for any immunizations, please contact us. We will help you in getting the vaccinations done. At your doorstep, immunizations done. The time is again coming for the flu shots very soon. The flu shots will be available, and you should get your the yearly annual flu shots to be inoculated to you. Thank you everyone for joining. Thank you, Dr. Ruby. It was nice talking to you.
Thank you very much. Sabko namaskar. Please take care of your health.